I'm Dr. Andy Karanas. I'm a board-certified general surgeon, and I practice with SSM Health Medical Group. I focus on abdominal surgery, so I see patients for gallbladder removals with small incisions, appendectomies for appendicitis, hernia repairs, intestinal resections for different diseases. Those are some of the more common abdominal surgeries that I do. And also, as part of my practice, is what I call lump and bump removals. So skin cancers, skin growths that are too large for a dermatologist to remove, or lesions, lumps underneath the skin. I remove those as well. I think when a patient is seeing a surgeon, they always have some degree of nervousness or anxiety just because of what I do. So I try to put them at ease by not rushing, by making sure that I explain things slowly and carefully. And I try to explain that they have choices. Surgery is one of the choices, but sometimes there are other options. I really think communication with patients is really important. When I get messages from patients, I prefer to call them and talk to them directly on the phone. I think sometimes texts and other modalities, nuances, emotions, questions get left out. So I try to pride myself on returning the messages, talking directly to patients and their family. I think that way things are very clear, all questions get answered. One of my principles is I'd like to take care of patients as I'd have family members or friends taken care of. And I really try to follow that every day. I think kindness, courtesy, respect, that's what I try to demonstrate every day.